Welcome to the Federal Health Insurance Marketplace in Indiana. This is Module 3, Training for Indiana Navigators. After reviewing this module, you will be able to explain what the Federal Marketplace is and who is eligible to use it and purchase coverage on the Federal Marketplace. You'll be able to explain the new Affordable Care Act requirements for consumers and for health insurance plans sold on the Marketplace. And you'll be able to explain insurance affordability programs, which will include an understanding of who is eligible for these programs and how these programs work. These insurance affordability programs will include premium tax credits and cost-sharing reductions. You will also understand and be able to explain health insurance plan enrollment using the Marketplace and when and how individuals can enroll in Marketplace coverage. Terminology that will be used frequently throughout this module include Marketplace and Federal Marketplace. The Marketplace or Federal Marketplace is a website that consumers can use to shop for and purchase health coverage and to have eligibility for insurance affordability programs determined. This Marketplace or Federal Marketplace may also be called an exchange. Qualified Health Plans, or QHPs, are a health insurance plan that has passed a Marketplace certification process. These health insurance plans are also reviewed by the Indiana Department of Insurance. Minimum Essential Coverage, or MEC, is a type of coverage that an individual must have to meet the individual shared responsibility requirements or the individual mandate. This is the requirement that individuals maintain minimum essential coverage under the Affordable Care Act. Insurance affordability programs refer to ACA provisions that lower the amount eligible consumers pay for premiums or cost sharing, such as co-payments, co-insurance, or deductibles. The two main insurance affordability programs are premium tax credits and cost sharing reductions. This section will cover the basics of the Federal Health Insurance Marketplace. Beginning in 2014, there will be two ways for individuals to purchase health insurance in Indiana. Individuals can still purchase health insurance through the commercial insurance market as they do today. The commercial insurance market is overseen by the Indiana Department of Insurance, and individuals, small groups, and large groups can seek coverage options here. The Federal Marketplace begins to offer coverage in January of 2014. This marketplace is administered by the Federal Department of Health and Human Services, and it serves individuals and small groups. Individuals will use the Federal Marketplace, and small groups will use the Small Business Health Options Program, or SHOP. The Federal Marketplace is a website for individuals and small businesses to compare and purchase health insurance. It also will assess individuals' eligibility for Medicaid. If the individual is eligible for Medicaid, the Federal Marketplace will send the individual's application to the state Medicaid agency. It will assess eligibility for premium tax credits and cost-sharing reductions, and will also complete individual mandate exemptions. The Federal Marketplace will manage eligibility appeals and facilitate enrollment in qualified health plans. It will ensure that appropriate premium tax credit and cost-sharing reduction payments are sent to the health insurance plans, and it will collect and publish quality data on the health plans. In addition, it operates a consumer assistance call center, and starting in 2015, it will collect premiums for small businesses. To be able to enroll in the coverage that is offered on the Marketplace, individuals in Indiana must be citizens, nationals, or legal residents of the United States, a resident of Indiana, and not be incarcerated. Individuals and dependents with these qualifications are eligible to buy coverage through the individual Federal Marketplace in Indiana. Even if an individual is not eligible for coverage on the Marketplace, this individual can use the Marketplace to apply for coverage on the behalf of any eligible dependents. The existence of the federal marketplace in Indiana does not limit individuals to purchasing coverage only on the federal marketplace. Individuals and families may still purchase coverage outside of the federal marketplace. The plans sold outside of the federal marketplace are regulated by the Indiana Department of Insurance, and some plans may have identical benefits to those offered in the federal marketplace. Additionally, some of the plans offered on the outside market may not be offered on the federal marketplace. However, plans that are offered outside of the federal marketplace are not eligible for premium tax credits or cost-sharing reductions. To purchase plans outside of the federal marketplace, individuals should contact an agent or broker for assistance or shop for coverage directly through the insurance company. The Small Business Health Options Program is a marketplace for eligible employers. In 2014 to 2015 in Indiana, the shop will be available for employers that have less than 50 full-time equivalent employees. For 2016 and after, the shop will be available for employers with less than 100 full-time equivalent employees. Employers that are using the shop may use agents or brokers as they do today, or can enroll in the shop independently. Qualifying employers can receive a tax credit if they have less than 25 employees. Starting in 2015, the shop will offer the opportunity for employers to choose either a specific plan or a selection of plans to offer their employees. Employers who choose a selection of plans will then choose a reference plan to help them set the contribution level for employees. This next section will cover requirements that apply to insurance plans under the Affordable Care Act that are sold both on and off the marketplace. These requirements include minimum essential coverage, essential health benefits, and actuarial value. The Affordable Care Act requires that individuals maintain health coverage for themselves and their dependents. This health coverage is required to be minimum essential coverage to meet the requirement. Minimum essential coverage is a list of coverage types that is determined by the federal government. This coverage type list will evolve over time, and there are currently some types of coverage that are only recognized as minimum essential coverage for 2014. Types of coverage that are not currently recognized as minimum essential coverage can apply to the federal government for recognition as minimum essential coverage so that individuals can use this coverage to meet the individual mandate requirement. Individuals may receive exemptions for themselves and/or their dependents from the requirement to maintain minimum essential coverage. These exemptions can be received either through the exchange or through the IRS at tax filing. To avoid paying the individual mandate penalty or the individual shared responsibility payment requirement, individuals have to maintain minimum essential coverage or receive an exemption from the requirement to maintain minimum essential coverage. The list of minimum essential coverage includes government-sponsored health insurance, such as the Medicare program, most Medicaid programs, Children's Health Insurance Program, veterans programs, including TRICARE and CHAMP VA, and coverage for Peace Corps volunteers. Employer-sponsored health insurance also counts as minimum essential coverage, as does coverage available in the individual market. Individuals that are covered on grandfather plans, even though these plans are not required to meet ACA requirements, will meet the individual mandate requirement to maintain minimum essential coverage. Self-funded student health coverage is considered minimum essential coverage in 2014. However, most student health plans are not considered self-funded student health coverage, so students will need to ask their health plans if they meet the minimum essential coverage requirements. Refugee medical assistance is considered minimum essential coverage, as are Medicare Advantage plans or Medicare Part C, and limited to 2014, state high-risk pool coverage is considered minimum essential coverage. However, Indiana's state high-risk pool, ICHIA, is phasing out in 2014. Additional coverage may also be specified as minimum essential coverage, and this list may be updated as the federal government identifies new types of minimum essential coverage. Some individuals may have health coverage that is not considered to be minimum essential coverage. For example, certain Medicaid programs, such as Medicaid programs that cover only family planning services or are limited to pregnancy-only services or emergency services, will not count as minimum essential coverage. In addition, limited scope benefits or coverage offered on a separate policy from primary health coverage will not be considered minimum essential coverage. This would include accidental death and dismemberment coverage, automobile liability insurance, disability insurance, workers' compensation, long-term care benefits, vision benefits, or separate policies to cover a specific health condition, such as cancer-only policies. Individuals with these coverage types will either need to maintain coverage that is minimum essential coverage, obtain an exemption, or pay the individual mandate tax penalty. Beginning in 2014, health insurers in the individual and small group market will be required to offer the essential health benefits. The essential health benefits are sets of benefits that are offered in the 10 essential health benefit categories. The first category is ambulatory patient services or doctor's office visits and outpatient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, prescription drugs, rehabilitative and habilitative services, laboratory services, preventive and wellness services, and pediatric services with oral, dental, and vision care must all be covered by individual and small group plans beginning in 2014. The 10 categories of essential health benefits do not identify what specific benefits will be covered under any category. To identify the specific benefits covered under, for example, ambulatory patient services, each state looked to a benchmark plan and categorized the benefits in that benchmark plan into the 10 essential health benefits categories. This set the baseline for the benefits that must be covered in the individual and small group market for 2014 and 2015. Indiana's Essential Health Benefit Benchmark Plan is the Anthem Blue Access PPO plan, and the link to the benefits in this plan is displayed on this slide. These benefits in the 10 EHB categories are subject to change in 2016, but they apply to the Indiana market for 2014 and 2015. All health plans that are subject to the essential health benefit requirements, which means all non-grandfathered plans in the individual and small group markets, have to offer plans at standard actuarial value levels. As previously mentioned, actuarial value means the average percent of medical cost the insurer expects to pay for all covered enrollees. For example, all plans in the individual and small group market have to offer plans in a certain metal level. So a bronze level plan would have a 60% actuarial value, or the insurer would expect over all enrollees that it would cover 60% of total medical costs, and that enrollee cost sharing would cover the remaining 40% of medical costs. Under a platinum plan, the insurer would expect to cover 90% of all medical costs, and the enrollees would expect to cover 10% of all medical costs through cost sharing. Plans with higher actuarial values or higher metal levels in general will have higher premium costs and lower cost sharing. For any individual selecting an actuarial value level plan, or for example, a silver plan, the percentage of costs covered by the individual may vary. Actuarial value represents the average over all individuals enrolled in the plans, and any single individual may pay more or less in terms of a percentage of medical costs than is displayed as on the actuarial value level. However, actuarial value is a good indicator of how rich the benefits in the plan are and how much an enrollee would expect to pay in cost sharing versus premiums. One type of health plan that is available both on and off the marketplace is exempt from the actuarial value requirements that apply to all other small group and individual health plans. These health plans are called catastrophic plans. Only limited individuals are eligible to purchase catastrophic plans, and individuals must be under 30 or have received an exemption from the requirement to maintain minimum essential coverage or the individual mandate to enroll in a catastrophic plan. Catastrophic plans require that enrollees spend a large portion of initial cost as cost sharing prior to the insurer covering medical expenses. In general, under a catastrophic plan, the deductible will be close to or set at the plan's out-of-pocket maximum amount, and the individual will be responsible for paying the majority of healthcare costs until this deductible is met. Catastrophic plans will, in general, have lower premiums. These plans are sold both on and off the federal marketplace, and for individuals who are eligible to enroll in these plans, they do qualify as minimum essential coverage and will meet the individual mandate requirements. However, individuals are not eligible for insurance affordability programs such as premium tax credits or cost sharing reductions if they are enrolled in a catastrophic plan. This next section will cover qualified health plans and the federal marketplace. All health insurance plans that are sold on the federal marketplace are called qualified health plans. These plans are required to be certified both by state and federal agencies to ensure that they provide minimum essential coverage, that they cover the essential health benefits, and meet the actuarial value standards and offer plans in the gold, silver, bronze, or platinum levels. These plans must also meet the provider network standards, which means they have to show they have a sufficient number of providers in the locations they offer the plans in the state to serve their potential enrollees. Health insurance plans are also required to contract with community providers in the area. Qualified health plans cannot consider the health status or pre-existing conditions of an enrollee for the purposes of setting a premium or deciding whether to allow the enrollee to enroll in the qualified health plan. This next section will cover insurance affordability programs, including premium tax credits and cost-sharing reductions. Premium tax credits reduce premium costs for individuals. These premium tax credits can either be paid directly to the insurance company to reduce individual premiums, or consumers can be eligible for a premium tax credit but elect to pay their premium in full, and consumers can claim the credit later when they file their taxes. To claim a premium tax credit, individuals must apply at the federal marketplace and indicate they are interested in eligibility for insurance affordability programs. The federal marketplace will determine individuals' premium tax credit eligibility and their premium tax credit amount. Premium tax credits are only available when coverage is purchased through the federal marketplace, and coverage purchased on the outside market or through small employers are not eligible for premium tax credits. The amount of premium tax credit depends on the cost of the marketplace's second lowest cost silver plan that would cover the applicant and their dependents, and the household income and family size. To be eligible for premium tax credits, individuals must meet the requirements to purchase coverage on the marketplace and be United States citizen, nationals, or legal residents. They must be residents of the state of Indiana and not be incarcerated. Individuals must also have income between 100 and 400% of the federal poverty level and not have access to other minimum essential coverage, which would include Medicaid or employer-sponsored insurance, or have access to minimum essential coverage, but the minimum essential coverage is unaffordable and costs more than 9.5% of the individual's household income, or does not provide minimum value by covering at least 60% of the expected medical costs. Individuals must file taxes to maintain premium tax credit eligibility. Individuals that are eligible for premium tax credits have 3 options for how to use their premium tax credit. The first option is to accept the full advanced payment of the premium tax credit. This means that the full amount of the premium tax credit will be paid to the individual's health insurer, and this will result in the maximum premium reduction amount the individual could expect. However, if income increases during the year, the consumer may owe back some or all of the premium tax credit when they file their taxes. Individuals may decide to accept a partial advance payment of the premium tax credit, which would reduce the individual's premium amount by the tax credit accepted. The consumer would receive a lesser premium reduction, but would be protected if their income increased during the year. If they are owed additional premium tax credit at tax filing, they would receive that fund from the IRS at that time as a refund. Additionally, consumers may be eligible for premium tax credits, but decline to accept the premium tax credits as an advanced payment. In this case, an individual would pay the full cost of their premium up front and would receive the premium tax credit when they filed their taxes and received their refund, either as a reduction in the tax amount owed or as a refundable amount. For individuals that decide to accept a full or partial payment of the premium tax credit, they will complete the application for insurance affordability programs through the marketplace and indicate they want help paying for coverage. The federal marketplace will determine their eligibility and estimate the premium tax credit amount. The consumer will decide whether to apply a full or partial premium tax credit payment to their premium cost, and then the consumer will select a coverage plan through the federal marketplace. The federal government will pay a full or partial advance payment of the premium tax credit to the individual's health insurer, and the individual will benefit by a reduced premium cost. The consumer will be responsible for paying the remainder of the premium to the health insurer. When the consumer files their taxes, actual annual income will tell the consumer how much premium tax credit he or she should have received. If over the course of the previous year they received too much premium tax credit, the consumer may have to pay an additional tax on the overpayment of premium tax credit. If they received too little premium tax credit, the consumer may get a tax refund or have the amount of tax they owe reduced by the amount of the premium tax credit they should have received. If consumers' income, household size, or location changes during the year, consumers must report these changes to the federal marketplace so the premium tax amount can be adjusted. Consumers can be determined eligible for a premium tax credit, but decline to have the premium tax credit applied in advance to their premiums. In this case, the consumer would complete the insurance affordability application through the federal marketplace and would indicate they want help paying for coverage. The federal marketplace would estimate their PTC amount and let the consumer know what this amount was. The consumer would decline the full PTC payment and select a health coverage plan through the federal marketplace. The consumer would pay the full cost of the premium to the insurance company, and when they file their taxes, the consumer's tax liability would be reduced by the amount of the premium tax credit, or the consumer's tax refund would be increased by the amount of the premium tax credit. Premium tax credits are calculated by taking the annual premium of the second lowest cost marketplace silver plan that would cover the applicant and their dependents, and subtracting the individual's or household's required contribution, which is determined on a sliding scale based on percent of federal poverty level. This amount is the consumer's premium tax credit amount. All individuals and families who have any level of income may be required to pay a portion of the chosen plan's premium costs, and the amount paid is dependent on plan selection. The premium tax credit required contribution amount is a percent of income amount that changes as individuals' income increases. So for an individual with 100 to 133% of the federal poverty level income, which is $11,490 to $15,282 in 2013, they would pay 2% of their income towards the cost of the premium. This would be an estimated annual contribution for an individual of $230 to $306 for the second lowest cost silver plan. Individuals' required contribution percentage of income increases as income increases. For example, individuals between 300% and 400% of the federal poverty level will be expected to contribute 9.5% of their income towards the cost of their premium before the application of any premium tax credit amount. After the individual's contribution, the premium tax credit will fund the remainder of the premium cost. The costs displayed on this chart are estimated contributions for the second lowest cost silver plan available on the federal marketplace. This estimated annual contribution will change based on the plan that the member selects. To give an example of a premium tax credit calculation, in Marion County, the estimated annual premium for a 35-year-old non-smoker second lowest cost silver plan is $3,912 annually for 2014. The premium tax credit amount is calculated by taking this total premium cost and subtracting the required contribution. In this case, an individual at 200% of the federal poverty level would have a premium cost of $3,912 and a required contribution of $1,448. The premium tax credit would fund the remainder of their premium after they pay their required contribution, and the premium tax credit amount for a 35-year-old non-smoker in Marion County would be $2,464 for 2014. The premium tax credit amount is based on the second lowest cost silver plan on the federal marketplace that would cover the individual and their dependents. However, the premium tax credit may be used to purchase any plan that is offered on the federal marketplace, with the exception of catastrophic plans. Individuals that choose a bronze level plan may apply a silver plan level premium tax credit to a cheaper premium. This will lower the consumer's premium contribution. Individuals that choose a gold level plan will apply the silver plan level premium tax credit to a more expensive premium. The consumer will be responsible for making up the difference in premiums, and this will increase the consumer's premium contribution. So, for example, with the same 35-year-old non-smoker who has a second lowest cost silver plan premium of $3,912 annually, their lowest cost bronze plan is $3,120 annually, and their lowest cost gold plan is $4,872 annually. Regardless of what plan the individual selects, the premium tax credit amount stays the same. But how the amount impacts what someone would pay is based on the selected plan. So for an individual at 150% of poverty level that has a premium tax credit amount of $3,222, if they select a bronze plan, they will have a $0 premium contribution. If they select the silver plan, they will owe over the year $690. And if they select a gold plan, they will owe in premium cost $1,650. Individuals that are eligible for premium tax credits may lower the premiums they owe by selecting bronze plans and may increase the premiums they owe by selecting gold plans. There are reasons individuals may not want to select a bronze plan, for example, if they are eligible for a cost-sharing reduction or expect to have a lot of medical expenses out of pocket. To be eligible for cost-sharing reductions, which is the second insurance affordability program, individuals have to meet all of the requirements for premium tax credit eligibility and have household income between 100% and 250% of the federal poverty level. Individuals also must enroll in a silver level plan at 70% actuarial value on the federal marketplace to receive cost-sharing reductions. Similar to premium tax credits, individuals have to file their taxes after the initial year of enrollment to continue to be eligible for insurance affordability programs. So what cost-sharing reductions do is they increase the actuarial value of health coverage plans for low-income consumers. What this means is that an individual will enroll in a 70% actuarial value plan, but will actually receive more value out of that plan than the 70% level. So instead of paying 30% of their costs out of pocket, they will pay less than that out of pocket. Cost-sharing reductions are offered in addition to premium tax credits, and qualified individuals do not have to apply separately for cost-sharing reductions. Cost-sharing reduction eligibility will take place when the individual applies for premium tax credits. So cost-sharing reductions reduce the total cost sharing an individual would pay when they are enrolled in a silver plan. This happens by an increase in the actuarial value of the plan and a reduction in the plan's out-of-pocket maximum. So while the maximum out-of-pocket amount for individuals that do not receive cost-sharing reductions is $6,350, for an individual from 100 to 133% of the poverty level, or who makes $11,490 to $15,282 a year, if they are eligible for premium tax credits and cost-sharing reductions and enroll in a silver plan, the actuarial value of that plan will be increased from 70%, meaning the insurer would pay 70% of the costs on average and the individual enrolled would pay 30% on average, to 94%. So the individual now will only pay 6% of the cost of any medical care on average that they receive. Their out-of-pocket maximum amount is also reduced from the $6,350 to $2,250, and in any plan year they may pay no more than that out of pocket. To receive the benefit of these cost-sharing reductions, individuals must enroll in a silver-level plan on the federal marketplace. Individuals that enroll in a bronze or gold-level plan and are eligible for cost-sharing reductions will still be subject to the higher out-of-pocket maximum of $6,350. This next section will cover enrollment in the federal marketplace. The federal marketplace initial open enrollment period begins October 1, 2013 and goes through March 31, 2014. Individuals must enroll during this period if they want to receive coverage on the marketplace. There are exceptions for individuals with special events, but in general, individuals that want to receive premium tax credits or cost-sharing reductions or enroll in marketplace qualified health plans need to seek coverage during the open enrollment period. Annual open enrollment periods after this initial open enrollment period begin on October 15th through December 7th of every year starting in 2014. Consumers may seek assistance with enrolling in marketplace coverage from Indiana Navigators, from health insurance agents and brokers, and from authorized representatives. To be eligible to enroll in the exchange outside of the initial or annual open enrollment period, individuals have to have a special enrollment period or special enrollment circumstance. These circumstances include the loss of minimum essential coverage, which may mean a consumer lost Medicaid eligibility or lost access to employer-sponsored insurance, gaining or losing a dependent or becoming a dependent due to a change in marital status, a birth, an adoption, or foster care placement, or the consumer or dependent gains citizen, national, or lawful presence status. Even individuals that are already enrolled in qualified health plans should report all special enrollment circumstances to the marketplace. Reporting all changes to the marketplace ensures that individuals' premium tax credits and cost-sharing reduction amounts are appropriate, and that individuals receive their special enrollment periods or ability to change qualified health plans when needed. Additionally, individuals may receive special enrollment periods if they have accidentally or failed to enroll in a qualified health plan due to an action or inaction on the part of an affiliate of the U.S. Department of Health and Human Services, if their qualified health plan they are enrolled in substantially violates its contract in relation to the consumer, or if the consumer becomes newly eligible or loses eligibility for the premium tax credit or cost-sharing reductions, then they may change their qualified health plan they are enrolled in and experience a special enrollment period. Individuals that move from one rating area to another or from another state may receive a special enrollment period, and consumers that are American Indians or Alaska Natives and members of federally recognized tribes can enroll in or change qualified health plans one time per month. There are also additional exceptional circumstances that consumers may demonstrate to receive a special enrollment period. Consumers interested in receiving a special enrollment period due to exceptional circumstances should contact the federal marketplace. Marketplace coverage does not initiate based on the date the individual submits the application. Marketplace coverage initiates based on the date the consumer is enrolled in the health plan. A consumer is not considered enrolled in a health plan until they pay their portion of the first month's premium. In general, consumers who enroll in health plans and purchase their coverage before the 15th of the month will have coverage that is effective beginning the 1st of the next month. Coverage that is purchased after the 15th of the month will not be effective until the following month. For example, individuals that purchase coverage during the initial open enrollment period between October 1st and December 15th will have effective coverage on January 1st, 2014. Individuals that purchase coverage after December 16th and before January 15th will have effective coverage February 1st, 2014. Enrollment in a qualified health plan in 2013 or 2014 will last for all of 2014. The individual will need to re-enroll in the qualified health plan during the annual open enrollment period in 2014. However, the individual does not have to reapply to the marketplace to re-enroll in the qualified health plan. The federal marketplace will take the information it currently knows about the individual and determine if the individual is still eligible for qualified health plans, for premium tax credits, and for cost-sharing reductions as applicable. So the individual can expect that they will receive a notice from the federal marketplace prior to the open enrollment period that will provide the information the marketplace currently knows about the individual. The individual can correct this information and send it back to the federal marketplace. However, regardless of whether the federal marketplace receives the return notice, the marketplace will check the eligibility of the individual for qualified health plans, premium tax credits, and cost-sharing reductions based on the available information. Once the marketplace has done this, it will send the consumer a notice that indicates if they are eligible for qualified health plans, premium tax credits, and cost-sharing reductions, and indicate what eligibility level or amounts they are eligible for. The consumer can decide to change their qualified health plan they are enrolled in, or stay enrolled in the same qualified health plan for the next plan year, and they may change any premium tax credit amount they have accepted. Consumers that do not respond to the notice of eligibility will be automatically re-enrolled in the same qualified health plan if it is available. To determine eligibility for premium tax credits and cost-sharing reductions, individuals must authorize the marketplace to access their tax information. If the marketplace does not have this authorization, it will only redetermine the individual eligible for qualified health plan enrollment, and the individual may not be able to receive premium tax credits or cost-sharing reductions in that year. So during the annual open enrollment period, when the marketplace checks to see if the individual is still eligible for marketplace programs, it will first check qualified health plan eligibility. Then it will look to see if the individual is eligible for premium tax credits and cost-sharing reductions. And finally, it will recalculate the premium tax credit and cost-sharing reduction amounts. So to check qualified health plan eligibility, the marketplace will look to see if the individual is still a U.S. citizen, national, or legal resident, if they are still an Indiana resident, and if they are still not incarcerated. To determine if the individual is eligible for premium tax credit and cost-sharing reduction eligibility, The marketplace will first check if the individual filed taxes. Individuals must file taxes to be eligible for continued premium tax credit and cost-sharing reduction eligibility. The marketplace will then check if the individual has coverage other than available on the marketplace. So does the individual have employer-sponsored coverage, or are they eligible for a Medicaid program? We'll check to see if the individual coverage option is unaffordable or does not provide minimum value if it exists. And then for premium tax credits and cost-sharing reductions, for those who qualify, it will assess if the individual is between 100 and 400% of the federal poverty level, or for cost-sharing reductions, if the individual is between 100% and 250% of the federal poverty level. For individuals eligible for premium tax credits and cost-sharing reductions, the marketplace will calculate the estimated premium tax credit amount for the next year and the estimated cost-sharing reduction level for the next year. As with the initial open enrollment period, individuals may select their amount of premium tax credit they accept, and they may change this amount at any time during the year. This concludes Module 3. Having reviewed this module, you should now be able to explain what the federal marketplace is and who can use it, the new Affordable Care Act requirements for consumers and for health insurance plans sold on the marketplace, the new insurance affordability programs, including who is eligible for these programs and how these programs work. These programs include premium tax credits and cost-sharing reductions. And you should also be able to explain health insurance marketplace enrollment, including when individuals are eligible for marketplace coverage based on when they apply for coverage, and how individuals can expect to experience re-enrollment in 2014.